latest breaking news that's coming in. Ozempic is all set to make its debut in India. India has approved the new treatment option for type 2 diabetes. The Central Drugs Standard Control Organization has cleared Novo Nordisk's world-famous drug Ozempic's injection containing semaglutide. The drug is administered under the skin and is meant for patients who struggle to control blood sugar through diet and exercise alone. It can be used either by itself or along with other diabetes medicines as well. It's manufactured in Denmark and France, and it's now available in India as a fresh hope for millions of people battling type 2 diabetes. We have my colleague Sudha Sadanand with us in the studio. Sudha, talk to us. This is big news. Ozempic is a famous drug. It's a fashionable drug now because celebrities from Hollywood to Bollywood are taking to it, and there's a lot of curiosity surrounding it.
Yeah, but you know, Krishna, the thing is that it is more about controlling type 2 diabetes. That's because I think India, I remember the Time magazine a couple of years did a special story on India and how it's become the epidemic in India. And now recently on, News9, on this very same channel that you're all watching, ladies and gentlemen, we spoke about how in India, if you look at it, the statistics are alarming when it comes to the South. Now, the misnomer, Krishna, is that South eats healthy, but then there are several other reasons. Now, coming to Ozempic, it's primarily a drug for type 2 diabetes, and there are lots of cases where despite metformin and all the other medicines that you take, somehow you're not able to control your blood sugar. The spikes happen. When do they happen? You have to keep a very, very close watch. Diabetics, also some of them wear, patches to see it. But of course, it is also about weight loss, and it is also about controlling your appetite. Now, that's why, Krishna, it's called a fashionable drug. But I wonder if that the pecking order should be, it controls type 2 diabetes, and 2, it keeps your weight under control, because if your weight is above what you should be, then obviously it's a kind of a bothersome thing for those who have sugar-related issues. And also the point is that, of course, a lot of stars have started using Ozempics, but I remember a book by very, very famous endocrinologist, Dr. Ambrish Mittal, who wrote a book recently called The Weight Loss Revolution. In that, he makes it very, very clear, Ozempic, but then how to use it is very, very important, Krishna.
Yeah, that's a very important message you're giving it also. I even as you're breaking this story that Ozempic is set to make its India debut. The Central Drug Standard Control Organization has cleared Ozempic injection. But as Sudha was rightly pointing out, you have to ensure that it is used in the right way. It is not exactly a silver bullet for all your problems. So it has to be ensured that the people are not jumping into Ozempic blindly, so that because they see all these stars losing weight and becoming quickly thin and looking absolutely fantastic, and in a sense these stars have become sort of brand ambassadors for Ozempic, isn't it? Although sort of official, no stars yet to officially come out and say I'm taking Ozempic, but the fact of the matter is that people need to exercise great caution before they choose to take Ozempic, isn't it?
Absolutely, very well said. And Ozempic is a drug which you can use even if you're insulin dependent, you see. So the thing is that it's an added layer. It's like you have something, if you're on protein, you also have a shake apart from what you ingest in your diet, so that your type 2 diabetes, and let me tell you about the popularity of it. I have some statistics in front of me.
Okay.
According to a pharmaceutical company, they say that the Indian market is steadily growing, and now it stands at around 625 crores as of June 2025. So it's accepted. I will not use the word popular, but it is accepted. But like Krishna Kumar said, with caution, if you have type 2 diabetes or if you're prone to, because I remember yesterday on Point we did a show about heart disease. A lot of young people are falling prey to that. One of the reasons is, are you screening yourself for your sugar levels? In case you find yourself that you are on the border, go to a doctor, consult him. But yes, it's a revolution. Ozempic now shall be in India.
And not just Ozempic, so that you have similar Ozempic drugs parallel to it, similar to it, also hitting the Indian market. This weight loss fascination, and And also, one is the fascination with weight loss, Sudha, and the other is the fact that, type 2 diabetes is probably one of the biggest diseases in this part of the world, in South Asia per se, and Indians particularly per se. It's a lifestyle disorder, and Indians have been found to be increasingly prone to it, and that is the reason why the high levels of, curiosity surrounding the solutions for type 2 diabetes, isn't it? And Ozempic is just the beginning. You're going to have more and more drugs from fellow other drug makers also hitting the market.
That's absolutely right. And let me also say about statistics, because we can call anything a revolution, but it has to be on News9. We always support it with data. The market in India has increased 27%, Krishna, and that's not a joke. And after all, we are very careful with what kind of drugs come in here, what kind of drugs are used. I remember there was a drug in between which was about enhancing your memory, and they put a lid on it and they said, this is all bunk. Nothing can really make you that, make you, kind of sharpen your memory. We also have...
Okay, stay with us, Sudha. We have Dr. Ambarish Mittal, Chairman and Head Endocrinology and Diabetes at Max Healthcare Hospital, now joining us. Dr. Ambarish Mittal, thank you so much for being with us over here. Ozempic is all set to make its India debut. I want your thoughts on that. The injection is what has been approved. It's not like Indians don't know what exactly is Ozempic, but now the Central Drugs Standard Control Organization has cleared the Ozempic injection.
Yes, I think it's great news. We've been using drugs of this class for the last 2 decades, but semaglutide is a significant advance for our people with diabetes for a couple of reasons. Basically, in addition to controlling diabetes very well, it also reduces the risk of heart disease. Heart attacks and major adverse heart events are reduced by about 25% in those who are on Ozempic, or those diabetics who are on Ozempic. Similarly, it reduces fatty liver disease, in fact, treats fatty liver disease. It reduces the progression of kidney disease. And on top of all that, it helps in weight reduction, which most diabetics require. So I think it's a very welcome addition to our armamentarium for treating diabetes.
Sudha here, nice to have you on the show. Many congratulations for your book, The Weight Loss Revolution. And here you are. I mean, here we get this breaking news. But doctor, the thing is that there are 2 aspects to Ozempic. One is, of course, for type 2 diabetic patients, how it controls. Like you said, you've been using it for 2 decades, but here it is. And perhaps it also kind of, restrains the liver disease and keeps your kidneys in shape. But then, what is your view about using it perhaps only for weight loss? Because that's a kind of an epidemic which is, spreading across the country, and particularly amongst those who want to stay, thin for whatever reasons.
So I think if you look at obesity as a disease, as we doctors do, as endocrinologists do, which means that if you have excess fat in the body, it's not just cosmetic. In fact, for us, that's the last thing. It's more important that obesity itself can give rise to a variety of disorders, of course, including diabetes, heart disease, high blood pressure, fatty liver again, and even types of kidney disease, some kind of cancers. There's so many things linked to excess body weight. Now, if we have a tool that can help us reduce that body weight, in addition to, of course, our diet and exercise and the things we've been talking about all these years, it's definitely a welcome addition. It does not mean that anybody can go on the drug. It also does not mean that people use it just to lose a few kilograms for cosmetic purposes. But those who are suffering the ill effects of obesity are clearly candidates for, GLP-1 drugs, including semaglutide.
Okay, Dr. Ambarish Mittal, I also want to ask, even as Ozempic is set to make its India debut, you have competitors. Eli Lilly's Mounjaro is there, and there are other competitors as well. Are all of these drugs in the category are the same in terms of the the benefits that they can provide, and also the risks that they entail?
So basically, GLP-1 drugs, as I said, have been around for 20 years. But the 2 that have made a big mark because of their powerful efficacy are semaglutide and tirzepatide. That is Ozempic and Mounjaro. Ozempic or Wegovy and Mounjaro. Now, these drugs are important because they are effective, far more effective than their predecessors. So broadly speaking, they have similar effects, but there are subtle differences. There are certain differences in the mode of action of tirzepatide or Mounjaro, which uses not just GLP-1 pathway, but also GIP pathway. So maybe it produces a slightly greater weight loss than semaglutide. Whereas semaglutide in persons with diabetes has been shown very significantly to reduce heart disease and other complications. So it's all a good thing for us doctors to have these options, for our patients to have these options so that we can treat, depending on the patient profile.